Now, we started off by thinking, OK, let's look at some of the areas where perhaps this tool's going to work very well. And one of those areas is home care, although it's not only about home care. And ultimately, we looked at home care overview inspection. It's reasonably recent. It's 2013. And what we got from this inspection is that they used 38 providers in this sort of snapshot summary, and it was decided that 28 of those providers were failing in care planning. I don't like the word failing. I think it's about struggling, and I think all care planning has a struggle, actually. So ultimately, 28 are struggling in care planning. The problems that they noted is care plans didn't have enough detail, didn't support people or staff to do a how-to. So the care plan would tell you about the person, but not necessarily how to respond. And our tool, absolutely, when you see it later, the person-centred planning tool is really driven by how-to in many ways. Also, it looked at the recorded documentation not necessarily being accessible, and sometimes with people who live in their own home, they get a carer coming in who they get used to, and then when that carer's on holiday or indeed leaves, they get another one and they feel they've got to say it all again. That's what the survey suggested, that people using services feel they're constantly reminding staff what it is they want and how they want it. So we've worked around a tool that hopefully is regularly and completely updatable in a very simple way. Also, looking at how you keep it current, up to date. Again, from this survey, it suggested that a huge number were out of date or from the original assessment, but 6 months later the person's changed in their ability or preferences, and it's not in their care plan. So we looked at those areas and thought these have got to be areas that we make the tool work, where we can make it work. Obviously, we're going to have to think about cost. Now, we've just looked at home care here because it's one area where we think the tool works very well. It's certainly not the only area we expect it to work. But the UK HCA, and those of you that work in home care will be familiar with this site, basically talked very clearly, and you probably can't see it very much from there, and you don't need to, but we all know the outcome of this little graph is there's going to be more older people, particularly, who need care. The explosion is growing, and Caroline will talk to you very much about those statistics in dementia, but ultimately it's a grower, an ageing population. We live longer, but do we live weller? And that's a very big question. We don't necessarily live weller, but we certainly live longer. Ultimately, we need to think about the explosion in numbers is expected, but the government is very clearly saying, but they're not releasing more money for it. So we've got to do more for less. You know, there's going to be more people expected, more staff expected for more clients, and yet the sort of, if we're looking at governmental budgets involved in that, they're not looking at double, tripling and quadrupling that. So this is going to be a tough area, and it's been a tough area for the last at least 5 or 6 years, I'm sure you're all aware. So we're trying to think of how this tool isn't going to cost you. Now, if you're a professional provider, there has to be a cost, but it's going to always and continue to be free for the person with dementia. And that's a part of the tool we'll talk about later. But if you're a professional provider, it is going to cost. We had to make sure it was going to make a saving in what the Home Care Agency have decided is the cost of home care. And they've looked at the biggest cost, and you know it, it's staff. Basically, it's time. Time is the biggest cost. Staff is your biggest cost, and running the business. So you've got over 11 quid and then just 4.25 quid to run the business. So we had to think of a tool that was going to be able to come out of this very tight budget of just under 16 quid. Okay, we had to see. So we had to look at what is included in these costs. And one of the things that is included and expected is that staff are trained. And yet we also found some data that very clearly suggested that, in fact, huge numbers of people who work in dementia do not have specialist dementia training. So we wanted to create a tool that had an added value for training, and we believe, and it will come clearer later, that we've created part of the tool that's going to support competence and skills building on the job. Not always. Some people need to go away on training. I mean, obviously, I'm a trainer. I'd like to think that sometimes they're going to arrive. But generally, that can't be the only way we improve competence. So we tried to create a tool that was going to improve competence whilst people were working. We responded very closely to that. So that's one area where we feel we can make a saving. Also, the time in running the business is for assessors to go out and do assessments of clients and then go back and pump it into a computer and then print it off. We've created a tool that can be done on the spot, also updated from its original rather than rewritten in a very, hopefully, very simple way. You'll get to see that later.
So Tricia's been talking to you about generic policy that's led up to the development of Home Spirit, and I'm going to talk to you about dementia and how we've been immersed in the subject and how through that process we've come up with the idea of Home Spirit. Now, I started my work with dementia as a very young social worker, and immediately I was thrown into the depths of dementia diagnosis, working in a mental health care of older people team. I sat around the table with occupational therapists, nurses, doctors, and even at that time, what struck me was the multi-perspective that was required to really get the measure of dementia, because it is such a complex subject. Fast forward 20 odd years and things have changed on some levels, but dementia is still a very complex subject. You know, it's still studied by neuroscience, geneticists, psychologists, sociologists. And with that, what has changed is that there's a much more of an integration between the topics, between the research. There's a lot more cross-cutting themes between psychology and health, for example. And to put this in context, for somebody with dementia who has purpose, hope and control in their lives, is more likely to use their brain more, is more likely to have relationships, is more likely to be mobile, is less likely to have ill health, and is less likely to have a hospital admission. And it all starts with purpose, hope and control. So how do we then reach people from a very early point, at the right point, and work with them in a very specific way? And that really has been our driving force. One of the other things that is key in policy is about research. And in the Dementia 2020, there's been an upsurge in research, a commitment to doubling the amount of money spent on research, and also a commitment potentially to having open access. And that's really important. It's really important that people get access to the research, because the research now is coming at such a pace. It's bringing with it new opportunities like what we've seen, hopefully, in Home Spirit. Timely diagnosis, really important, not only from the perspective of people making decisions, but if you get people early enough, what happens is people have the cognitive power to sense make, potentially to develop coping strategies. Post-diagnostic support, also really key in terms of getting the support at the right time for people. And we know that MDAS work very, very hard in Hertfordshire to make sure that people get the support that they need in a very structured way. But what happens next? What happens after that kind of support? Hopefully what the Home Spirit tool offers some kind of consistency or follow-up. As Tricia's already said, that there is also in policy this expectation that people with more complex needs are supported in the home environment. But how is that possible? Dementia costs our economy £23 billion per year. 10 billion of that is spent in care costs and a staggering 11 billion on informal support. What if we had developed a tool that can support both informal support through family carers or carers? I'm reminded recently not all carers are family carers, and also support services. The other key area is around training, and this is something, you know, a lot of these were on the initial strategy in 2009. And since then, as training providers, we have been immersed in the subject of dementia at a very, very exciting time where the research is coming very, very quickly. So we know Tier 1 and Tier 2 is available around the health service. In terms of communities, it's Dementia Friends. And in terms of social care services, it's been us, 3 Spirit, providing a lot of the training over the last 8 years. And what I'm going to talk to you very briefly is about the kinds of things that we've been working with and how this has sort of led up to the development of Home Spirit.
We're going to move on now, and we're just coming into the tool, but I wanted us to talk about if you like, the NICE guidelines 2015, particularly around home care, like I say, this tool should and can work across the board, but we're focusing in particular around home care because we feel this is where it'll work maybe easiest or quickly. It might be uptake in that place first. Recognising that we wanted to use the NICE guidelines around home care, we wanted to create the tool that directly responded to that. So we know that it should be goals and aspiration-led, and aspirational-led is what we're very interested in. Person-centred planning is all about dreams and goals. Also focusing on what people can do. Now there's a problem with our tool, one small problem, we couldn't change it. One part of it starts with need rather than strengths, and we will be changing that around so we didn't get a chance before the hard launch today. But starting with what somebody can do, that's all good and well, but the truth is nobody gets funding for things they can do. They get funding for things they can't do. So from the very beginning, it starts off very much as a needs-led approach. We want this tool to be much more about what people can do and building upon that. Recognising, very importantly, that again in the NICE guidelines, there's an expectation that we get information out there, not just information about care, but information outside of care, such as assistive technologies. But I do want to make a point about assistive technology. They're fantastic and innovative, and we were at the Alzheimer's show on Friday, and you can pick up and touch things that are brilliant, yeah, that work, but they're expensive. We also know that there's an expectation that people have a written summary of any planning they have, so our tool creates a written summary, which you'll see later, that people feel safe and they have peace of mind. Well, I'd like to think that this tool supports peace of mind because it's pretty holistic, but it's also controlled by the person, we hope. We'll talk about that in detail later. That we recognise that people have to and will continue to take risk. And in fact, positive risk-taking is a really important part of this drive, is that because we provide someone with care, it doesn't mean we should know everything about their life. In fact, they might not want you to know everything about their life, and that might involve some risk. So what can we do to meet all these nice outcomes? And this is the moment where I wanted everyone to scream out, Home Spirit tool, but I'm not sure that emotionally I've got you there yet on that one. And I don't expect you to assume that it's the answer to all of these expectations. But Caroline and I really believe it could be. And what's important is that you have an opportunity to see it. And we're quickly going to go through the platform just here, you're going to see the platform in a second, but it covers certain areas. One is the Circle of Support, and it's a relationships tool, meeting all the expectation around community support. Those of you that have used Circles of Support in the past will recognise that we're supported by many things, not just people. And actually, Circles of Support shouldn't just be about people. We could be supported by our library or supported by the pub, actually. A pint of beer could be part of our Circle of Support. It doesn't have to be humans. It could be a dog, you know. Ultimately, the Circle of Support needs to be a dynamic tool, so we hope we've created one. We also hope we've created one that's very movable and very easy to use, and we're going to show you that in a moment. But also a tool that hopefully, for some people, moves the professional support from being their only support toward the outside and actually brings in the community. That's the idea. That I've worked with people whose their whole circle of support in the past has been paid. You know, the tragedy of that life, where everything and anything that supports them is someone who's paid. And what we need to do is start looking at that and think, well, there's something really wrong here if somebody out there has only paid support in their life. And maybe that's a good way for us to sort of plan to support them in other ways. It involves risk-taking, Circles of Support. It does involve risk-taking. You know, we start getting into regulations. If somebody arranges for someone from the Gurdwara to pick them up to take them to their place of worship, or indeed on a Friday they want to go to the mosque, they might say to us, I've got someone picking me up from the mosque, they take me there. Now, it might be easy for us to say that's great, but then we start thinking, are they CRB checked? You know, have we got sort of all the right regulation in place? And that stops people being in control. And is it any of our business if they've chosen somebody from the church or the mosque to support them to go there in the day? Is it any of our business? No, I don't think it is, actually. So we need to start knowing when to butt out as well, and I think the Circle of Support might help us to do that. There is an environmental tool. The environmental tool can stand alone. All of these tools can stand alone. And Caroline's going to go through the environmental tool with you. We hope that the environmental tool really grows, actually. And you can see when you look at it with Caroline, its potential, I believe. The person-centred planning tool is a big part of this tool. Person-centred planning can come from lots of directions, but for somebody I've always believed it has to come from aspiration and dream, but it has to come from the person being in control. For those of you that have done PCP training, you might have used a tool before about important 4 and important 2. It should always start with important 2 and important 4 for a start. What's important for me is to lose 3 stone and stop smoking. I know that's important for me. What's important to me is roll-ups and magnums. You can see the conflict, yeah? There's a direct conflict. Now, if you were going to knock up a care plan for me, I'd want you to first start with the fact that I want to smoke roll-ups and I want to eat magnums. And from there, I want you to plan what's important for me. And that might be to think about other things I might eat, or how often I smoke, or perhaps that's something I can do to combat the effects of smoke. It can only become important to me when I care about it. I've got to lose 3 stone at the very least. I can tell you now, I'm not interested in losing 3 stone for the sake of losing weight. But if you told me I was going on holiday to Paris with Leonard Cohen and Bob Dylan, I'd lose 3 stone by the weekend. And I would. And it's to do with wanting to do the outcome. The outcome is what's going to drive any of us. And a lot of our person-centred planning, I think, starts from the wrong position. It needs to start from what does the person really want in their life, what's important to them. And in that, we have to fit care, risk, support, and what's important for them. But it should never be the driver what's important for them. It's always got to be what's important to them. So you'll see by the time we get to the tool that we've started from that position.